Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square, where they care about my health.
Hello and welcome to For the Health of Me. I'll be interviewing Jennifer Adam. She is a school nurse from HSA, and Dave O'Driscoll from the Cayman Islands Cancer Society. Hello and welcome to For the Health of It.
Thank you.
Thank you so much. Very happy to be here.
And we're going to be talking about Arm Against Cancer. Now, when you think about that, you're thinking about putting on armor. But is it a shot in the arm or both?
It's a little bit of both.
Okay. So, explain the program.
Yep. So what this is for the human papilloma virus vaccine. And the best one that's out there on the market now, Gardasil 9. What's amazing about it is it's actually a vaccine that can help our community avoid cancer. So the actual virus and what comes from that, the illness, but also cancer down the road.
And that is why you're here, David, right? Because people who get cancer from this virus come to you for help sometimes.
Yes, yeah. On the long road that is the cancer journey that begins with contracting HPV, yes, as very often the case, we will end up supporting that person.
Now, I'm just going to put this out there because I know we have some 80-year-old granny listening, and she's going, why are they doing a vaccine in our schools? So you want to explain that?
Well, it's a good place to be able to offer up vaccines in the community. Every single time that it is given here in Cayman, any vaccine, it is with consent of the parent and only with consent of the parent. And with this program, there's lots of information on multiple websites, on HSA's public health website, on the Cancer Society's website, as well as the Ministry of Health's website. To answer questions, there's phone numbers there to be able to call and ask direct questions, also contacting healthcare providers just to go through any concerns that they may have. Additionally, too, parents are welcome to be there with the child. So the children are of age where they can be getting it at school by themselves, year 7 and up, but parents can also choose to be there with them.
But more than that, right? This is about prevention. And some of these cancers that you get are pretty virulent, aggressive. They come at a young age, which puts people at a distinct disadvantage because it cuts their longevity, or it can. And sometimes it's even missed because they're so young, these are one of the multitude of reasons why this program is so.
Definitely.
Because at my age, I'm in my 60s, we didn't have this. And, you know, there were people dying at 40 of preventable diseases, and this is why we're doing this now.
Well, that's it. Dr. Gent has been with us during this promotional campaign. He is an encyclopedia of knowledge when it comes to epidemiology, which is his specialty. But vaccines are some things that aren't given on a whim. They are things that are researched for a very long time. They are thoroughly tested. The results are studied. And when they are finally happy after years of this research and studies to introduce it to entire communities, to the global population, only then will they go ahead with it, knowing that it is completely safe. And we know that is true for many vaccines, which in the last 100 years, which have been incredibly successful.
Absolutely.
There is no polio anymore. There is no whooping cough. There is no smallpox. Do you know? This is how important the HPV vaccine is. It's right up there with them. This is something that can, if done right, and if there is a very positive take-up, you can have 90% eradication of cancers such as cervical cancer, mouth and throat cancer, anal cancer, penile cancer in the Cayman community, which would be fantastic. The people who get cervical cancer are all very often young mothers, which is the worst time to get any kind of disease, let alone cancer. So this is something that is absolutely for the best of the community and to bring us going forward with one disease less to worry about. But actually many diseases less, like HPV and cancer.
I guess we should be asking reverse a little bit. What is HPV?
So it's human.
Good question.
Yep. Filling it in. So human papilloma virus. So it's a sexually transmitted infection. And it is very easily contracted. It's just from skin contact. So, and it's very prevalent. Many people over are exposed and contract it in their life. So it's one of the most common. So for giving this vaccine, it's approved and safe to start being given at 9 years old. And the reason why we start at that age and why they studied it at that age is because the children's immune systems are ready, they're geared up. That is the best time to get the vaccine in, get the good response from the immune system so that later in their life, when they are exposed, that they have full protection.
Yeah, one and done. One dose and they're done for life. Fantastic.
Yeah. And is it just for girls or is it boys too?
It is for both boys and girls. The virus is, both genders can contract the virus, and so both genders do need the vaccine to protect each other and themselves.
Yeah, the most, I guess the most common, or for use of a better word, the most popular cancer that is resulting from contracting HPV is cervical cancer. So in previous years, they were targeting girls.
Just females.
Mostly, but obviously it's with further study, it's been realised that it is the network of contraction that this vaccine needs to break down, and it travels to men and boys just as much as it travels to women and girls as well. So this is a blanket operation, break down the transmission network completely, and basically you're doing it for the ones you love. You're doing it for your family, for your kids, so that the next generation has no chance of contracting it. Fingers crossed.
When you say break down the transmission network, you want to just explain that? I think I understand it, but I want to make sure that
yes,
our audience does.
Well, because it is a communicable disease, so it can be transferred from a boy to a girl, to a girl to a boy, and some may not show any symptoms. Some can be fine. It can be just genital warts and nothing else, or it wouldn't even show at all. But the next person might be much more severe. So just because you are a boy and you don't hang out with girls and you don't kiss girls, that doesn't mean that you are not part of the network, that you are not at risk yourself or at risk of carrying it.
What would you say to a parent who is listening to this interview and saying, are they encouraging my children to have sex?
It's been a question, definitely. We've heard it.
I'm sure.
Yes. And, with reassurance, it has nothing to do with trying to encourage sexual activity, even giving a lot of information regarding that during any type of consultation and information to the children, because they are young. They're 9. Here in Cayman, we primarily focus on 11 and up, but it is approved from 9 and up. And at your private, especially the private clinics that are now involved in the program too, and at Public Health, it can be done younger from 9. But it is not going to encourage or create any kind of change in the children from what their previous decision would have been.
Yeah. And this has been proven by studies.
Absolutely.
Many studies over the years.
Yeah, because it was a concern brought about by parents that has been shown by research.
So. We encourage all the questions.
Absolutely.
Mm-hmm. You were saying earlier that, sometimes it skips one and goes to another person. Mm-hmm. Sometimes it shows up as cervical cancer. Mm-hmm. Sometimes it shows up as...
well, it wouldn't show up as cervical cancer. It would show up as HPV, but down the line.
That's what I mean. Sorry.
Yeah.
Thank you for clarifying that. And it shows up as, you get cervical cancer as a result.
Mm-hmm. Yes. Yeah.
Sometimes it goes to anal cancer or throat cancer.
Mm-hmm.
Yeah,
right?
Mm-hmm. All of the above.
And it doesn't happen at 20 years old. Sometimes it does it?
Absolutely.
It can. It can act quickly. It not. Yep. Mm-hmm.
Okay.
Yep.
Yeah, we've had patients with mouth and throat cancer in their early 20s. We've had mothers in their early 30s with cervical cancer. But then we've also had at women in their 50s with cervical cancer as well. So it doesn't discriminate. It doesn't wear a watch. It strikes when it wants to strike if it is given the opportunity. So let's not give it the opportunity.
Mm-hmm.
And usually the cervical cancer, if I remember correctly, it's usually found too late in women. Am I correct in that or not really? I'm fine to be corrected.
with scheduled pap smears, that's what that's looking for, is cervical cancer. So as long as somebody is doing their screenings properly, and that has shifted a little bit, the recommendations there, but based on research and based on what is required to be able to catch it in time. So as long as somebody is doing that, then hopefully they would be catching it in time to treat it at an earlier stage.
And we, at the Cancer Society, we have a pap smear voucher program. So if anybody wants to get their HPV testing done along with a pap smear and their insurance won't cover it or they're financially unable to cover it, then give us a call, drop us a line. We are actually working with local clinics, and that if they do recognise that it is time for you to get a screening and your insurance is exhausted or there's some reason why you can't afford it that day, they actually work with us and we'll provide the voucher there and then at that minute for them to administer the screening same day, because that's how important this is. If we can have people following their screening schedules, their vaccine schedules when they're younger, then we have the best chance of eradicating many cancers. Not just cervical cancer through HPV, but also prostate cancer through regular PSA screenings.
So the school vaccination program, how does that work?
So we have a team of nurses, our school health nurses through HSA, and the school administrators have been provided the information to pass along to parents. This year we're using a QR code to be able to sign up, as well as for people who don't have access to using a QR code or they just would like a paper copy. They can also get a paper copy sent or picked up at the school, and parents can contact the school regarding that if they haven't heard anything, or they can contact us straight through at Public Health as well and School Health.
Yeah. I'll give the numbers real quickly for Public Health, just in case you're just about to jump out of the car. The numbers are 244-2648, or you have 244-2889. And if that was too fast for you, you can go to CICS.ky. All the information is there on the homepage. Click it, and there you will actually have the links to the QR code, to the helpline, also to all the participating clinics. Because yes, as Nurse Jennifer said, it's not just Public Health and Ministry of Health, Environment and Sustainability that is undertaking this amazing campaign. They are also partnering up with many of the private clinics just to ensure that we give people every opportunity possible. So as well as all the district clinics, including the clinics, the public health clinics in Little Cayman and Cayman Brack, you also have many of the private clinics, including 7 Mile Medical Centre, Cayman Doctors, the Strand Medical Centre, Health City, Doctors Hospital, Integra. They're all doing it, and they're all doing it for free for children aged 9 to 25. If you're outside that range, please do call anyway, because we are trying to get as much coverage as possible.
And it is approved for up to 45 years old. So between 25 and 45, it's still covered when it is discussed with their healthcare provider or public health nurse and deemed appropriate for that person to get the vaccine.
Now, going back to the need for that, what are the statistics that we have? I mean, are there statistics that say that, HPV, we have 100 people, we have a population of 100,000, and we have 999,000 people. I'm just trying to understand.
I know, and I really can't give you an answer to that, because HPV shows on many forms symptom ranges from nothing, something noticeable. Asymptomatic, yes. And also, we don't have a cancer registry. Well, we do have a cancer registry, but we don't have a comprehensive cancer registry, unfortunately.
It's just voluntary.
It's just voluntary, yeah. So the numbers we see aren't the true numbers. But from what we see, and I think the CMO will back us up, is that the numbers are kind of in line with most countries, in the Caribbean at least. And to say they're not good wouldn't be a lie. So there's definitely a need to up our game in terms of getting this vaccine out there to the people, to the community. They've seen fantastic results in many first world countries, such as Sweden, Australia, and Scotland, just to name a few, that they've invested heavily in countrywide campaigns just like this, and they've done the follow-up research, and they've followed the results. They've followed the people who've taken the vaccine for years. And they've seen, some of the countries are actually on course to have many cancers, including cervical cancer, eradicated from the population by 2030 or 2034, I believe. And if we could get in line with that, with this successful campaign this year, this would be fantastic. Imagine, 6 or 7 years down the line, that everybody's getting their pap smears, but they're all coming back negative, and it's almost guaranteed. Brilliant.
And is the correlation between HPV and cervical cancer, is that like hand in glove? It's usually by that.
Yes.
Yeah.
Yep.
And anal cancer and throat cancer.
Throat cancer, penile cancer, neck cancer.
Yeah. Are you going to run out?
If we do, we'll get more. Yes, that's the slogan.
Yes,
yeah,
that is
don't
right.
worry about that. Because as we said, it is being offered for free to all boys and girls, men and women between the ages of 9 and 25. Obviously, we're focusing on the incoming year 7s in the high schools especially. But it is available, as Nurse Jen said, it is available for women between the ages of 25 and 45. And for men who have sex with other men, and that there's no age range there.
Okay. I was reading something the other day, and it said that the most prevalent group of HPV spreaders now are the people in nursing homes. So
that they might need to expand their studies.
I thought that was funny, actually.
Yeah.
What would you say? Someone is talking. Do both of you have children?
Yes.
Okay.
Yep.
How do you have the conversation? Let's say with your child.
I have 2 olders that got, so this is Gardasil 9, just to back up a little bit too. Gardasil 9 protects against more strains of the human papillomavirus as well. The main ones that cause the cancers, okay? And so it used to be Gardasil 4, and so we've improved, which is great. So with my older 2, it was a different series. You had to get 3 vaccines. Now it's just the 1. But I just approach it as health. It's just to protect them. And just as any other vaccine, that when, they don't like it. Kids don't like getting vaccines at any age. I don't think many. I'm a nurse. I give vaccines. Many adults do not like getting vaccines,
Yeah, you don't
regardless
lie.
of
It'll
the
probably
reason.
get worse, actually.
Yeah, I know. But, I just approach it as, the things that we have available to us that can improve your health, just like we're going to choose to hydrate well every day and eat good food. It's the same thing with vaccines. We have this opportunity to protect ourselves, and this is why we're going to do this.
Okay. Now, parents, that must be a little harder sell because it is sex, and you might think it's like hydrating, but we have people who unfortunately think you might be encouraging, which you're not. It's to hydrate. It's to make sure that your body will be healthy down the line. And I think for me, if I had children, I would be give it to them because it's a prevention. It's not.
It's a great opportunity as well for children that age to, if you want to have the talk with them. It is a great time. And we talked to Dr. Gent about this on another radio show, that as we all know, and I'm definitely an advocate of this, fathers are doing much more these days, and they're much more part of the family dynamic. I know I change my fair share of nappies. I have a 3-year-old and a 1-year-old, and I'm in there. I'm like every morning, every evening, and I love it. And this is great. And there's definitely a huge shift. Like I think I saw a statistic not too long ago that men changing their kids' nappies is actually up 80% from the generation before, which I would believe.
Good job.
Right? Thank you. I'm flying the flag. But it's another great opportunity for the fathers to actually be the ones to give the talk, and to give the honest talk, because I think we're moving away from birds and bees and the storks, and to give the truth. Kids are growing up faster. Kids are smarter at a younger age.
Social media.
Social media is there, because if you don't tell them the truths, they'll find out you're lying pretty quickly, and we're not as great as lying as we think.
No,
they know.
Kids know.
They know.
Yeah, because before they are communicating through speech, they are communicating through gestures and body language, and that is the pantomime you give away when you're lying. So it's a great opportunity. I'm looking forward to it. That when I can tell them about what's ahead of them, but what we as a community have as our arm against cancer to prevent many diseases. And I won't just talk about HPV and the cancers that may it lead to, but also many of the other vaccines that they have been involved in. And yes, and the simple art of actually preventative education and eating healthy, exercising, getting regular checks, getting to know your doctor. This is all part of just combating any disease that's out there and making sure that you're ready for it.
And even though there are questions here in the community, that definitely is, there have been a lot of questions. It has been been a very good program throughout the years since 2010. Parents have stepped up and across Cayman and have brought their kids in, initially the girls, and then now moving on to the boys and the girls. They're there for it. It's not as many questions as volunteering and consenting, and asking questions, making sure they have the right information and making sure that it's safe for their child, but it's more so parents stepping up.
Good. I mean, I remember the first interview I had on this show about this. It was, I think the radio station got calls like we were promoting, and I was like, huh?
Yeah.
It's prevention.
People see it that way, but look, we know those questions will be asked, and that's fine. It means you are, turning every stone. You
engaged in
that
that's
you
okay.
were listening, and you want you're saying, okay, I want to do this. I just want to make sure I'm making the right decision, and that's fine too. In fact, the Cancer Society will be in Cayman Brac next weekend on Saturday the 11th at the Cayman Brac Beach Resort with Public Health and HSA administering the vaccine for free. And so if anybody wants to pop down there, they don't have to get the vaccine right there and then, but we'll be there to answer any questions that they have if they don't have a chance to call in now.
Does it hurt?
Yes, every vaccine hurts a little bit.
It's a needle in the arm. It's like a punch in the arm.
It's a little sting. Sometimes people find that when the actual, because it's a liquid, right, that goes in, it's a little bit of a burn, but it's when you see all the kids come through, yes, they're nervous before it happens, and then usually the comment is, oh, that wasn't too bad, and they hop up and they head off. So yeah, it's a little sting, but you guys, we can do it.
If you saw what they were avoiding down the line, it's nothing at all.
Exactly.
A little bit of discomfort at maybe 9 years old or 11 years old. It avoids years of chemo or surgery or...
Absolutely.
Yeah, exactly. A drastic reduction surgery. Yeah, loss of life.
Yeah. Because I believe that's what Farrah Fawcett died of. That might be before your time, but
I know Farrah Fawcett, Charlie's Angels.
Yeah, she died of anal cancer.
That's right.
HPV. Yeah.
Okay.
So, what would you like the audience to know before we close out?
Well, I would like them to know that from first-hand experience, working at the Cayman Islands Cancer Society, that we do see a lot of incidents of cancer that can be avoided through early detection and regular screening. And this is a fantastic opportunity. Now, if the take-up is great, that is going to avoid so many of these cases that we see, and that we won't even see people getting cancer, we won't see people getting uncomfortable genital warts and all the other things that come with HPV. This is something that's tried and tested. It's now the Gardasil 9 vaccine, which is an amazing product, thoroughly tested. It's the evolution of the Gardasil 4, so it's been advanced, exactly. Yeah,
big time.
Yeah. So the research is undeniable, and the fact that our government is doing all this for free, and will continue to do it until they get the entire population vaccine, if that's possible, then it's fantastic. We should commend them for it, and we should take them up on their offer.
For sure. And for me, I have the opportunity and the honor to work with our kids here in Cayman. And when I look at their faces and, they come in for a little cut, we talk a lot more than just about a little cut. Check in with them and how life is going and what they had for lunch, what they had for breakfast. This goes right along with it. How can I be a part of protecting our Caymanian kids, all of Caymanian kids, and make sure that we're doing our part to make them healthier people in the future? This is a part of it, and it's something that's accessible, it's free, and it's answers questions can be answered. You can feel comfortable doing it and know that many parents around you are doing the same thing and making the good choice of protecting our kids.
Can expat kids get it for free?
Absolutely. Oh yeah. Everybody living in Cayman.
Yeah.
Oh, yeah.
All residents.
All residents.
Okay. Well, how do we sign up for this program?
All right. Well, like I said, you can go to cics.ky. We've got a full page with all the information on that.
Arm
Against Cancer. Yeah. Arm for Cancer. Yeah. Also, you can go to hsa.ky. Follow the links for public health and HPV. There you will find the QR codes and the links that will allow you to download the consent form. In fact, it's not even downloading; it's actually a live form. You can just put in your details, and then your schools will be notified, and the school nurse then will actually schedule your kid to be vaccinated.
We hold the clinic at the school, so we organize that out, arrange it there at the school, and depending on numbers, over multiple days or one day. Again, parents can come and be there with their child if they would like to.
Accompany your child if you want to. That's fine too.
And we hold the clinics there at the school, and you get sent the notification that it was completed, and any follow-up that you may have, then parents can contact us.
So they could do it on their own, or sometimes it's organized through the schools?
Correct. So they can go to public health to get it done. They can go to any of the clinics that are also a part of this program, this outreach, the district clinics as well, Little Cayman, Cayman-Brac as well, and then Dave mentioned some of the private clinics that are doing it also.
Yeah. There's also a list of the private clinics. There's a link to that too. And like I said, Doctors Hospital, Health City, Cayman Clinic, Cayman Doctors, 7 Mile Medical Centre. And if you are a clinic and you're not on the list, please do reach out to the Ministry of Health and Public Health to be added to that list. There's no limit to the amount of private clinics, because, like I said, we want the best opportunity possible for everybody in the island.
Just accessibility.
Accessibility,
Just, yeah.
Exactly.
Mm-hmm.
And Cayman Brac next Saturday on the 11th of October, we will be there with Public Health administering the vaccine for free.
Thank you so much for being on For the Health of It. You've been listening to me interview school nurse Jennifer Adams from HSA and Dave O'Driscoll from the Cancer Society. We are moving you to the life you want.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Yesterday,
Today,
always and forever.
Radio Cayman in the Cayman Islands.
The following is a message from BAF Insurance, where your health is our priority. October is Breast Cancer Awareness Month. Get tested now. This means you too, men. Male breast cancer is more common than you think. Get tested now. A little bit of discomfort today can mean a whole lot more life later on, because early detection saves lives. Contact your medical provider today and get tested. A message from BAF Insurance, where your health is our priority.
Are you feeling overwhelmed, sad, stressed out, or suicidal and need support? Call 1-800-534-6463. K-Mind, Mental Health Helpline. It's okay to ask for help. K-Mind Mental Health Helpline, available from 6 p.m. to 11 p.m. Monday to Friday. It's free and confidential support and guidance on your emotional and psychological health.
You are listening to Radio Cayman, the voice of the Cayman Islands.